So this patient right here, very interesting situation. So with her, she had a really rough time eating, chewing food. She wasn't happy with the way that they looked. She wasn't happy with the way that she felt. She said that she felt kind of depressed, that she would never really smile at people. Inwardly, she just did not feel like she was her 100% best self.
Okay.
So what we did for her is we gave her a brand new set of upper and lower teeth fixed in with dental implants.
Okay, let's take a look at the after.
Yeah, absolutely. So you can see her new teeth. Now, a couple of things that you would notice about her new teeth. Would you say that that makes her look a little bit younger?
Yes.
So one thing you'll notice right here in the after shot, you'll notice that these teeth actually fit her face better, right, than her original teeth. In the original, like before she came in or when she came in, she had these black corridors, is what we call them, where you can just see blackness on either side of the teeth that goes all the way back. And that's because she was missing all her posterior teeth. She had nothing to fill the space. In the new ones, we gave her that back, and it fills her mouth. It fills that space.
Good.
Yeah, so much better. In addition to that, on the first one, you're going to see that you see a lot of gum tissue. You're going to see gaps in between the teeth, and that the teeth are kind of worn down. But on the new one, you don't see anything like that. When she smiles, it looks so natural, and it follows the bottom lip naturally.
So on that after photo, the teeth, is that done on a computer to make it look this good?
So we do this. It can be designed on a computer. When I did this one, we had somebody that just makes teeth for a living. That's all they do.
Okay.
And he made this and designed it with my input to be that perfect for her. So one thing, as she's come back for her follow-on treatment, she's told me, I'm able to enjoy foods that I couldn't enjoy before. I can eat a salad if I want to eat a salad. I can actually chew food so that when I'm swallowing it, I'm not choking on it anymore. So her standard of living, her standard of life has been greatly improved just by having regular teeth.
What do they like more? What they could eat and chew, or the way it looks?
Yeah, at first she came in looking for the ability to chew food, right?
Okay.
What she did not know that she was going to get was the ability to smile and be really happy about her smile again. So she got both, and I think she loves both of them right now.
What's that like when they look at their face and their teeth for the first time, when they get the new teeth?
It's been a range. I've had people break down and cry. That's a pretty common reaction. I've had people that are just stoked, give me a thumbs up, and they're on their way.
Okay.
So it kind of varies for her specifically. Like there were a lot of tears shed for her. It's kind of like she has a second chance, a new lease on life. An opportunity to be what she knew she was on the inside, but she just didn't have the smile to support how she felt about herself.
Now, could they eat like whatever they want? Like whatever you normally could eat with strong teeth? Like could they bite a carrot with their front teeth, or an apple, or like a corn on the cob type of deal?
Yeah, absolutely. So I actually had a patient just last week bring in an apple. And so as soon as we put in her teeth and finished everything out, she took the apple out of her bag, took a big bite out of it. It was something she hadn't been able to do in 20 years.
Like right after you put the teeth in there?
But that was her number one thing that she wanted to do.
Is that scary for you? I mean, do you really want to do that?
Oh, yeah, absolutely. I want people to enjoy themselves.
Okay.
The reason we do this is because I want people to feel whole. And when you're limited in any way, you don't feel whole. For her to bite an apple, that patient specifically, she said that her next thing that she was going to do is go home, be with the family, eat ribs where she could bite it off the bone, and eat corn off the cob. So these are the things that people want to do just to feel normal, right? I take so much of this for granted in my life, right? But this has given me a sense, working with people like this, a sense of, there's so many things that I do in my everyday life that I should stop and recognize how wonderful it is to be able to do those small little things. And one thing I get from feedback from patients all the time is, you'll see in her before picture that she spent 10, 12 years in this situation where she was losing teeth one at a time. And when we gave her all her teeth back, the number one thing that she said afterwards was, why did I not do this earlier?